Hi guys, welcome back to my YouTube channel. I'm Blessing. If this is your first time coming on this channel, you're welcome. If you're not subscribed to this channel, kindly subscribe because I put out 2 videos weekly. You don't want to miss any of my content because it's so educational. Okay, so let's get into today's video. On today's video, I'm going to be talking about newborn vital signs, newborn warning signs to report, and I'm also going to be talking about newborn normal and abnormal findings. Let's get into today's video. This semester I got to do family health. It was so much fun, and yeah, I'm just going to be sharing my knowledge with you. So we'll start with the newborn vital signs. Newborn's temperature axillary only. It should be just under the armpit, okay? And the normal range for that is going to be between 97.7 degrees Fahrenheit to 99.5 degrees Fahrenheit. In Celsius, that will be 36.5 degrees Celsius to 37.5 degrees Celsius. For the pulse, the normal pulse is going to be between 110 to 160 beats per minute. You want to auscultate at the fourth intercostal space. And respirations for this baby is going to be 30 to 60 beats per minute. You could also count respirations by looking at the newborn baby's chest. You could do this by observing the rise and fall of the baby's chest. The blood pressure is going to be 60 to 80 systolic over 40 to 50 diastolic. Warning signs you need to report. If you see any of these things, just immediately report. If the baby has respiratory distress, if you see the baby grunting or the baby is breathing too fast, above 30 to 60 breaths per minute. If the baby stops breathing, so like you witnessed apnea for greater than 15 seconds. If you see a bluish discoloration maybe around the mouth or just every part of the baby is blue, cyanosis, you have to report this. Initially, when they give birth to the baby, it's okay to see some cyanosis around the extremity, which is what we call acrocyanosis. This is fine. But if you see sequemoral cyanosis, the round bluish or central cyanosis, you want to report that. If the baby's pulse oximeter is less than 95, you want to report that. If the baby has no bowel movements in 24 hours, we should look at that. Yellowing of the skin or green or bloody vomit is something we also want to report. Moving straight to talking about the newborn normal findings and abnormal findings. So for a full-term baby, the posture of that baby is usually flexed. So if you see the baby looking limp, that's abnormal. We talked about the acrocyanosis, which is normal. This is for the skin. The baby should be pink, no sequemoral cyanosis, no central cyanosis. You might see some lanugo, which is that soft hair covering the baby, like the fine hair. You might also see milia, which is okay. Those are the white, it's like white bumps kind of trapped under the baby's skin. You might see erythema toxicum. I know this sounds dangerous, but it's not abnormal. It is a normal finding in a newborn. It's a temporary rash that you might just see on the baby's skin. The baby has the diamond fontanelle at the top of the head in front and the triangle fontanelle at the back of the head. So we want to closely monitor those and report if it's bulging or sunken, because if it's bulging, it might mean the baby is overhydrated, and it shouldn't be sunken, which would mean the baby is dehydrated. We also want to look at the baby's head. There's also something called caput succedaneum, and this is a normal finding. It's usually caused by pulling the baby out from the mom's vagina. It could cause pressure, and the head could kind of bend towards the direction in which the baby was pulled out from. This is okay, it will resolve on its own. But something you want to be scared of is cephalohematoma. This is hemorrhage of blood, where blood pools under the baby's scalp. This is abnormal. And for the face, of course, you want the face to be symmetrical. You want the baby to have like equal movement. Report any asymmetrical movements. For the eyes, look at the shape. Make sure that the pupils are equal and reactive to light. Report hemorrhage. Also, if you see any tears present in that baby, you want to report that. For the nose, babies are nose breathers, especially if you see them sucking on something. Sometimes when we want to do the assessment, we just like put our gloved hand into the baby's mouth. If the baby is sucking and there's no retractions, the baby seems all right, you could tell that the baby is breathing fine. But if you see the baby flaring to breathe, there is a problem. The baby should have pink and moist lips. You might see Epstein pearls found on the baby's palate. That's fine, that's a normal finding. But make sure you report if the baby's tongue is protruding, that's the problem. If you see thrush in the mouth, please report that. For the year, when you bend a full-term baby's ear, you should recoil immediately. Report any ear that seems lower than it should be, or if the baby has hearing loss. The baby's neck should be short and well creased. If you see anything like webbing, which is like extra skin folds, just like hanging, we should report that. For the chest, the baby's chest should be symmetrical and the chest would be barrel shaped. Report any respiratory distress, any grunting, or if you see that the baby's clavicle is fractured. For the baby's abdomen, we want to look at the cord, the umbilical cord. You should be able to see 3 cords, which is 2 arteries and 1 vein. Make sure bowel sounds is also present. Report if the baby has a distended abdomen or maybe you don't hear bowel sounds. For the male genitals, the male's testes should be distended and the male's private organ should be centered. And of course, reports if the testis is undescended. There's something called hypospadias. This is where the opening of the urethra, instead of being in the middle of the penis, it's like downwards, so we want to report this as well. It's a misplaced urethral opening. For the female, we want to see a swollen labia. You might see pseudomenses. This is okay because you know the baby is just detaching from receiving all of mom's hormones, so don't be scared. This is a normal finding. Reports if you see any vaginal tag. For the upper extremity, you want to see full range of motion. Remember, this baby is flexed. If you pull the baby's hand, usually they flex back their hands, so report asymmetrical movements. Then for lower extremities, we want to have a negative Barlow's and Ortolani's maneuver. These are exams to screen the newborn for hip instability, and we want to report if there is a positive Barlow's or Ortolani's maneuver. I'll probably make a separate video showing us how to do the Barlow's and Ortolani's maneuver. Report uneven leg length as well. For the baby's back, we want to make sure that the spine is intact and flexible. And when you turn the baby to the back, also check, make sure there is no hole and there is no tuft of hair at the back, because this is spine bifida and it's a birth defect where the spinal cord and the spine don't form properly. So if you see a tuft of hair, report that immediately. And for the baby's anus, you just want to access to make sure that the baby passed meconium in the past 24 hours. That's all the normal findings and abnormal findings plus vital signs of the newborn.